The term Fragile X refers to a group of conditions caused by defects on the FMR1 gene on the X chromosome. This prevents the manufacturing of a protein vital for normal brain development and function. The following is a summary of our group's research on the biomedical information, behavioral aspects, and funding and legislation of Fragile X syndrome.
So thank you very much for meeting me. I really appreciate it. I'm just going to put this out there. You're the professor of pharmacology and director of educational computing at the University of Toronto, now retired, the Faculty of Medicine, parent of a son with Fragile X, and on the board of directors for Fragile X Canada. So very impressive, my friend.
My son is 40, so he's one of the older Fragile X kids.
How did Fragile X present itself in your son in such a way that you led to a diagnosis?
Good question. Slow development.
Okay.
And that was obvious actually long before we thought of Fragile X. But that's a common finding that the pediatrician or one of the home nurses says, you know, he's not meeting the goals as he grows.
Yeah.
So this is, you know, even 6-7 months.
Okay. So
but nothing obvious at that point.
Gotcha.
In retrospect, we realized he had bigger ears and his face was more rounded than anyone else in the family. And there is a Fragile X look. If you see a bunch of older Fragile X kids, they have some similar, it's a bit like Downs, they have a lot of similarities. At the time when we were diagnosed, we just got lucky. We thought we were bad parents, and I think a lot of people do that too.
Yeah.
So we went to a lot of parenting courses, and in the end, we were selected to be at a conference on parenting.
Yeah.
Someone in the back of the audience yelled out, "Have you ever thought of going to a physician and seeing if there was anything actually wrong with Michael?" By this time, he's 3.5.
Okay.
So we went to a pediatrician who, by happenstance, had gone to a talk that included Fragile X. He said, "I don't think it's this, but let's throw in the test for Fragile X and see what happens."
May I ask why he didn't think, but may I ask why he suggested that it wasn't Fragile X?
He never heard of it.
Oh,
I mean, most GPs haven't.
Yeah, I've noticed that seems to be a problem in terms of diagnosis, that they just don't have the background.
That's right. And the GPs don't have a background. If you're lucky enough to get a medical geneticist, they obviously know.
Yeah.
And the genetic counselors know. In fact, the genetic counselors are probably the best source of information of anyone. There just aren't many genetic counselors in Canada. The powers that be say that if you have a child, a son particularly, with developmental delays, they should be tested for Fragile X.
Of course, yeah, because it does run on the X chromosome, which means it's a little bit more prevalent in men than it is in women.
Yeah, and the symptoms, they used to say that the girls get less symptoms, but as we go through, it doesn't seem to be the case. The pediatricians are a little better informed.
Okay.
If everybody was prenatally tested, it would help, except the rules at the moment say, if you test for something for which there is no treatment, we're not going to support it.
Right. So that's why there's not prenatal testing, due to the fact that there could be some ethical issues involved.
Yeah, and you run into it too with the rest of the family, because the mother is must be a carrier.
Of course.
So the carriers there are now 4 defined areas where carriers have problems. So although we think carriers, they're free of symptoms, they actually do get various things. There's a tremor, there's a neurological component, there's a tremor component, there's a ovarian cyst component. My wife now has the tremor component, and like a lot of mums that have had Fragile X, she's also on tranquilizers and anxiolytics.
All right, so it started to present in her a little bit later in life, I suppose?
Much later, yes.
Interesting. Right.
I think initially it was the stress of looking after someone who has issues. And then after that, it realized it really wasn't just that, it was something else altogether.
the method of diagnosis with which you would go through to be diagnosed with Fragile X, is that a genetic testing? Is that
Yes.
Yeah. Okay.
Yeah, it's a genetic test. The old way of doing it was very crude and only said you either had it or you didn't.
Gotcha.
Nowadays, they do testing for repeats of the CGG component, and they may actually do the degree of methylation. There seems to be a relationship between the higher your methylation status on those repeats,
Gotcha.
the nastier the symptoms might be.
In terms of educating practitioners, is there anything that you would put in place, any measures that you would put in place in terms of education to make them more aware and to make the ability for diagnosis easier?
Yeah, we think that the best way of going at it at the beginning is to go after the pediatricians.
Okay. And
because almost every baby is going to go to a pediatrician.
Of course.
There's a smaller number of them than there are GPs.
Right.
So if the pediatrician picks it up before the kid is moved over to a family doc, that might be the way to go.
And then you could get adequate treatment at a younger age, which I'm assuming would be beneficial.
Which is what you want, yes.
Yeah.
Yeah.
Gotcha.
And actually that would include pharmacological treatment, because it seems like some of the drugs work at certain ages.
Okay.
And that's a whole big issue, because there's like, I don't know, maybe 9 or 10 different drugs that are currently being used to ameliorate symptoms. They don't treat Fragile X.
And that would lead into my next question about the pharmacology and the medicinal avenues of how to treat.
You treat the symptoms.
That's it,
So anxiety is treated.
Okay.
My son, for example, still, when he gets frustrated, he'll bang his head.
Yeah.
That's I should have said the early symptoms: head banging,
Yep.
screeching.
Okay.
Trying to think. Try to forget those things, but the head banging and sort of in general physical activities were prominent by the time he was 5 or 6. So because he head bangs, we think it's because he gets endorphins.
Right, of course.
Opioids.
Yeah, physical stimulation.
Sorry, opioids, not endorphins.
Yeah.
So he gets treated with naloxone. That's the morphine antagonist. It also
Right.
blocks the
Gotcha.
opioids. So he gets 2 or 3 of those a day.
Wow.
And it
And that must
reduces
affect
blood.
him in his day-to-day life. Does that affect other areas of his life in terms of his?
Doesn't seem to.
No.
Doesn't
Okay.
seem to.
Gotcha.
But so he takes buspirone to reduce his anxiety. He takes the naltrexone. What else does he take? Yeah, that's the only things for Fragile X.
So basically, you're just treating the symptoms. Then there's no pharmacological solutions to treat any of
No.
the. Okay. Interesting.
There's 3 new drugs that are being tested: minocycline,
Yeah.
which is really an antibiotic.
Yeah.
But in the first test, it seems in clinical trials that it might do something for some of the Fragile X kids.
Okay.
Cyclosilbine is being tested. That clinical trial is starting sometime this year.
Interesting.
CBD.
Yeah, I could see that being
and
anti-anxiety.
actually, I guess THC as well are
Yeah.
being tested with some degree of success.
No, just out of curiosity, because you have that pharmacological background, when you are testing THC with patients such as Fragile X or even the autistic element, I know that it can bring onset of schizophrenia at a young age. Would there be any correlation between that in terms of negative side effects of using THC?
I don't think we've got enough data.
Yeah.
I haven't seen that as being a significant side effect in the reports, but these are early reports, so they're a little bit cagey about what they say about them. If nothing else, it keeps them stable at the point at which you start treatment.
Okay.
So they may not get better, but they won't get worse.
And that's something.
And if you catch it early enough, that might actually be significant.
Fragile X syndrome diagnosis can be helpful to the individual involved because it can provide a reason for the intellectual disabilities and socially significant behavioral issues. A diagnosis will help the families better learn about their disabilities and better help the child achieve their goals. Every case/person with Fragile X syndrome is different and can range from minor to severe. From a very young age, developmental delays can occur, and this can include trouble sitting, walking, and talking at the same time as other children their age. Likely they'll also have social and behavioral problems, including but not limited to making eye contact, anxiety, issues staying focused, especially in busy environments, acting without understanding implications, and being extremely active. It's likely that children with FXS will have learning disabilities as well, and these attributes will create barriers that the individual will have to overcome later on in life. Treatment and modern day treatments. In 1943, Bell and Hames Purdon Martin made a discovery of sex-linked mental de-escalations. These issues were found to be related to the X chromosome of a carrying mother or an infected father. At birth, children with FXS do not exhibit any clinical signs. However, when the child starts to develop, in early childhood, physical and developmental features become more noticeable. Fragile X syndrome does not have the single treatment process. However, the treatment process is designed to target socially significant behaviors and minimize symptoms of the condition. People with FXS should have access to appropriate education, therapy services, and medication, allowing them to have the best opportunity to achieve their goals. Students that are diagnosed with FXS should have access to an IEP, allowing educators to make proper accommodations to ensure the best possible outcome for their students. An example of an accommodation could be the ability to work in a separate, quiet environment. This could help their anxiety, allowing them to separate from high-stress environments, for example, a classroom with many students. Furthermore, students with FXS might also need a proctor or a verbal communicator. For example, if a student can't complete a test by themselves, they can use a proctor and verbally answer the questions instead of relying on self-focus and fine motor skills over a long period of time. Early interventions are important because a child's brain is still developing and will give the child the best chance to develop the full range of skills. The faster the child gets treatment, the more possibilities there are for learning. People with FXS have many appealing personality attributes and many strengths in addition to the challenges that are associated with FXS. The most common behavioral challenge associated with FXS is anxiety, aggression, self-injury, ADHD, and social interaction difficulties, including but not limited to social anxiety or withdrawal from social environments. People with FXS might also have significant sensory processing issues, processing information. There are two main sensory systems that are affected by FSX. First, sensory discrimination issues. Sensory discrimination issues lead to poor coordination or dyspraxia. This can cause difficulty with oral motor skills, e.g. overstuffing the mouth, or poor oral control. Difficulty with muscle sense, like trouble learning how to ride a bike, or problem with using too much or too little force. Furthermore, there can also be issues with the auditory system, difficulty distinguishing between similar sounds or talking too loudly or softly. Lastly, fine motor skills can be affected as well, and holding a pencil or performing a task that involves the movement of small objects can be difficult. Second, sensory modulation is responding to brain function responsible for arousal, alertness, attention, organization, and more. Some difficulties can include visual system, difficulties tolerating bright lights, or making good eye contact. It also affects the auditory system, making it tough to tolerate loud noises like a lawnmower. Lastly, sensory modulation can affect their touch sensors and can cause trouble tolerating certain fabrics and issues working with writing utensils. People with FXS syndrome can also experience a high state of arousal or hyperarousal. These challenges is thought to be triggered by the biological aspect or increasing by social environment that the individual is in. Due to the overstimulation, hyperarousal, the individual with FXS might feel anxious or fearful. FXS can have such a large and wide impact and can affect every aspect of someone's life, including their job, school career, and their personal life. For example, a person with FXS can have an increase in anxiety and difficulties in social interactions, meaning high stressor situations can be extremely difficult for these individuals. Two examples. First one, police officer example. For example, an example of a high stress situation could be someone with FXS getting stopped by a police officer. The person with this DD will feel extremely anxious due to the unknown situation and might want to remove themselves, e.g. running away. This will then encourage the police officer to run after them and arrest them for suspicious behavior. The situation, although likely to occur, could be minimized with proper training from both parties. First, all police officers should be trained and understand and identify basic characteristics of the disability and retort properly. Secondly, the person with the disability, depending on the severity of the condition, should be given the opportunity to practice high stressful situations. Classroom example. A child with FXS might also have trouble with social situations and understanding social cues. This could be detrimental in social environments like a classroom. For example, the class clown has everyone laughing and the teacher finally settles the class back down. Someone with Fragile X syndrome may not recognize that the moment has passed and continues on the joke. They do not pick up on the social cue that the spontaneous interruption is over and continues adding to and disrupting the class. From the point of the teacher, the child with FXS is interrupting. However, from the point of the child, it's a double standard because he's being reprimanded for the same behaviors as the class clown.
Today I have with me David Mitchell. David Mitchell is a member of the board for Fragile X Canada Foundation, and I'm really happy to have him here with me today to answer some questions rather. David, I was hoping you could maybe just give a brief introduction on yourself.
Yeah, thanks, Peter. Really happy to be with you today. I'm currently serving as president of the Fragile X Foundation of Canada. We're a volunteer-based organization. I'm based in Calgary presently. I've moved around the country quite a bit in my roles, focusing on public policy and university leadership in a few different institutions across Canada. And I'm a former MLA from British Columbia, so my background is quite varied. I have a grandson who is now 9 years old, who was diagnosed when he was younger with Fragile X. And that's how I became involved in learning more about this rare genetic disorder. And through my efforts, I became involved on the board of the foundation, which is going through a bit of a generational transition right now. And maybe just for context, I'll mention that the Fragile X Foundation here in Canada has been around for a quarter of a century. But in the past, its focus was exclusively on research, research treatments, and ultimately finding a cure. What we've done in the last short while is started a transition where we're broadening the focus of the foundation. We're not abandoning research, but we're now putting as much emphasis on building awareness of this disorder because it's not well known, making connections, forming partnerships with other organizations who are focused on other disorders of various kinds like autism, Down syndrome, ADHD, etc., and also doing advocacy at various levels. So we're broadening the scope, and we're in the process of doing that right now.
Fragile X can bring a wide range of challenges in affected individuals and can exist in combination as a learning, cognitive, and physical disability. And as I understand, Fragile X is also frequently misdiagnosed or undiagnosed. So my question is sort of twofold. In your experience, do you find that to be true? And if so, what do you feel are the greatest challenges in properly diagnosing Fragile X? Yeah,
that's a really pertinent question and one that occupies us at the foundation. It is true that this condition is often misdiagnosed or misunderstood at the very least. What we're doing to try to counter that is to build awareness, not only awareness amongst families, but awareness amongst physicians, both general practitioners, specialists, other health-related professionals, educators, We're seeking to build awareness. We started that process. We have ways to go. In Canada, it's a little bit challenging at times because to do it nationally is not to do it very effectively because so many of the policy or fields are provincial jurisdiction. Right. But you're absolutely right. That's an issue, and it's at the forefront of our focus.
My next question is kind of sort of getting more into organizational or sort of the legislative side of things. Your organization is made up of I want to say purely volunteers, but I'll say mostly volunteers, and receives most of its funding from private donations and fundraisers. And I wonder, do you receive any public funding or support? And if so, what are the challenges involved in receiving that?
Yeah. Our organization is led by a volunteer board. That's absolutely we're all volunteers. That may change as we move forward and as our mandate becomes broader, as it is becoming right now. So, for instance, we're not emphasizing the R in the FXRSC. We're de-emphasizing research as our exclusive focus. We're simply branding ourselves as the Fragile X Foundation of Canada. Fragile X, because our mandate's broader. Our funding has been primarily philanthropic. That's correct. Through donations or fundraising events. We are a registered charitable organization in Canada, and we issue tax receipts for contributions when they're requested, and we have the ability to do that. But we're wanting to expand and diversify our funding resources to support families and family engagement at the community level as well. And so we're looking at, in the months ahead, in the years ahead, looking at public funding, possibly uniquely focused on Fragile X or in collaboration with other organizations as well.
Bill C-81, or the Accessible Canada Act, came into force in July of 2019, and many people, and I would include myself in this, many people feel like it was a crucial and important step forward in Canadian disability legislation and will ideally remove many physical barriers and allow for equal access throughout Canada. So my question to you is, since its introduction, have you noticed the intent of Bill C-81 being put into action?
The shorter answer is no. There is promise there and expectation and hope, but none of those by themselves have translated into much concrete action.
Right.
But we do think that the legislation is an important building block. There's another prospective piece of legislation right now that we're also quite interested in, which is the Canadian Disability Benefit Program, which the federal government has indicated that they're bringing forward again. They had made a commitment to it prior to the most recent federal election, but the Canadian Disability Benefit Act could potentially be of great help for families who have an individual with a disability of any kind, and to ensure that they're not adversely affected by lack of income or poverty.